The janitor's hands moved before anyone could stop her. 4 seconds. That's all it took. The trauma chief froze mid-step, his face draining of color as he watched. That's impossible. That technique doesn't exist? The woman didn't look up from the patient, her fingers maintaining perfect pressure. Tell that to the 6 soldiers I saved in Kandahar using it. The ER went silent. Blood stopped pooling. Monitors steadied. The patient gasped, pulling air into lungs that had been seconds from collapse. Dr. Morrison stared at the woman in janitorial scrubs, his medical degree suddenly feeling very small. Who the hell are you? She finally met his eyes. Someone who's trying very hard to be nobody. The woman's fingers pressed into the exact intersection where the subclavian artery met the first rib. Not above it, not below it, exactly there. Her thumb found the posterior triangle, creating a compression angle that shouldn't work according to every trauma protocol Morrison had memorized. She was redirecting collateral flow through intercostal vessels, using the patient's own anatomy as a pressure valve. 1947, 4 minutes since the patient had crashed. The monitors screamed, then steadied. The impossible happened right there in front of 12 witnesses. Blood stopped pooling beneath the gurney. Morrison stood frozen 3 feet away, his brain trying to reconcile what his eyes were seeing. This violated everything. The angle was wrong. The pressure points were unorthodox. The technique didn't exist in any textbook he'd ever studied, yet the patient's vitals were climbing. Systolic pressure rising. 70, 75, 80. Her hands never wavered. Proximal compression maintained with surgical precision while her other hand palpated for distal pulse. She was monitoring circulation downstream, ensuring she wasn't creating compartment syndrome while stopping the bleed. The ER had gone completely silent except for the monitors. Even the chaos of the other bays seemed to pause. Dr. Reeves stood beside Morrison, mouth slightly open, watching a janitor perform trauma medicine that neither of them could explain. Morrison found his voice. It came out harder than he intended. Step away from my patient. Now. She didn't move, didn't even look at him. He'll bleed out in 30 seconds if I do. Her tone was flat. Factual, not argumentative. She was simply stating a medical reality. Morrison's face flushed. This was his ER, his patient, his authority being challenged by someone in a sanitation uniform with a mop bucket still visible in the corner where she'd abandoned it. The standoff stretched. Monitor beeps filled the space between them. Steady now, regular. The patient's pressure holding at 85/60. Not great, but alive. Reeves leaned close, his whisper barely audible. Chief, the bleeding actually stopped. Morrison saw it himself. The arterial spray had been coating the woman's forearms 30 seconds ago. Now the gauze beneath her hands showed only minimal seepage, venous bleeding, manageable. I don't care what luck just happened. You're not authorized to even touch a patient in this hospital. You're sanitation. You clean floors. You don't perform medical procedures on trauma victims in my ER. So I'm telling you one more time to step away before I have security remove you, and I call the police for practicing medicine without a license. And the monitor alarm cut through his tirade. The patient's oxygen saturation plummeted. 92, 88, 82. Tracheal deviation visible now. The man's neck twisting slightly to the left, his chest rising asymmetrically. Tension, pneumothorax. Morrison saw it the same instant she did. But she moved first. 14-gauge needle, 5th intercostal space, mid-axillary line. Move. Her voice cracked like a whip. 2 nurses responded instantly, not because they knew who she was, because command voice bypasses conscious thought. They'd heard that tone before, in disasters, in mass casualties, in moments when hesitation meant death. Morrison started forward. You can't just perform a needle decompression without imaging, without confirmation, without... She already had the needle, already palpating the 5th intercostal space, already angling the catheter at precisely 90 degrees to the chest wall. Morrison watched her hands. Perfect positioning. She wasn't guessing. She knew exactly where the pneumothorax was located based on physical exam alone. Tracheal deviation, absent breath sounds, jugular venous distension, the needle-punctured skin, advanced through intercostal muscle, pierced parietal pleura. The hiss of escaping air was immediate, loud, unmistakable. The patient's chest wall relaxed. His trachea shifted back to midline. Oxygen saturation climbing, 85, 89, 93, 96. She held the catheter steady, watching the monitors, waiting for complete re-expansion before securing the needle in place. Textbook. Better than textbook. Morrison had performed this procedure hundreds of times. He'd taught it to dozens of residents. He'd never seen it done with such absolute certainty. No hesitation, no double-checking, pure muscle memory and anatomical knowledge. The patient stabilized, completely. Pressure holding steady at 90/65, oxygen at 98%, respiratory rate normalizing. The crisis had passed from critical to manageable in under 2 minutes. She stepped back. Her hands were shaking now, just slightly. A fine tremor in her fingers that she tried to hide by clasping them together. "He's yours now, doctor." She turned toward the doors. Morrison's voice came out quieter than before. The anger had drained away, replaced by something he couldn't quite identify. Confusion, awe, professional curiosity that bordered on obsession. "Where did you learn that?" She didn't answer. Just grabbed her mop from the corner where it leaned against the wall, started pushing it toward the staff exit as though nothing extraordinary had just occurred. Nurse Rodriguez was staring. She was 40-something, had worked ER for nearly 20 years, had seen everything from gang shootings to natural disasters. Her face showed pure recognition. That was field medicine, combat field medicine. Morrison's brain was racing, the technique, the speed, the absolute confidence under pressure. The unorthodox approach that worked precisely because conventional methods were failing. This wasn't luck. This was training, experience, hundreds of repetitions until the movements became automatic. He looked at her name tag as she pushed through the doors. A. Graves, Sanitation. "Ms. Graves, we're not done here. You can't just walk away after performing emergency procedures on a critical patient. I need answers. I need to know where you trained and why you're working as a janitor when you clearly have advanced medical knowledge." And the doors swung shut. She was gone. Morrison stood in the middle of his ER, surrounded by staff who were all looking at him for direction, waiting for him to explain what they'd just witnessed. He turned to Reeves. "Pull her employment file. Now. I want everything. Social Security number, previous employment, references, educational background. Everything." Reeves hesitated. "Chief, shouldn't we focus on stabilizing the patient? He still needs imaging, probably needs surgery for that arterial repair. And we should—" Morrison was already walking to the monitor, checking vitals, confirming what his eyes had told him. The patient was stable. Against all probability, given where they'd been 4 minutes ago, this man was going to live. That woman just did something I've never seen in 20 years of trauma surgery. He paused. Let that statement hang in the air. She stopped an arterial bleed using a compression technique that isn't taught in any program I know. She diagnosed and treated a tension pneumothorax based on physical exam alone in under 90 seconds. Perfect execution. Zero hesitation. He looked at the doors where she disappeared. "I need to know who she is." Reeves nodded slowly and headed for the administrative office. Rodriguez was still standing beside the gurney, looking at the gauze where Graves had maintained pressure. The blood had stopped completely now. Just venous oozing that they could control with conventional methods. I've never seen anything like that. Morrison didn't respond. He was running through everything he'd witnessed, trying to find an explanation that made sense. Combat field medicine, Rodriguez had said. That fit. The improvisation, the confidence, the ability to work with minimal resources and still achieve impossible results. But it raised more questions than it answered. Why was a combat medic working as a janitor? Why hide those skills? Why walk away after saving a life instead of accepting the recognition that anyone else would demand? The ER was returning to its normal chaos now. Other patients needed attention. The crisis had passed. But Morrison couldn't let it go. He kept seeing her hands. The precise positioning, the absolute certainty, and the trembling afterward. That detail stuck with him most of all. She'd been rock solid during the emergency, unshakable. Then the moment it was over, her hands had started to shake. That wasn't just adrenaline. That was something deeper. Morrison had seen that tremor before, in medics returning from deployment, in surgeons after particularly traumatic cases, in people who'd learned to function under extreme pressure, but paid the price once the immediate threat passed. His phone buzzed. Text from Reeves. Got the file. You need to see this. Office in 5. Morrison took one last look at the patient. Stable. The man would need surgery, but he'd survive, because a janitor had stepped in when conventional medicine was failing. He headed for the administrative office, questions multiplying with every step. Who are you, A. Graves, and why are you hiding? Part 2. Forced exposure and backstory reveal, 2130. Morrison sat in the administrative office staring at the thinnest employment file he'd ever seen. A. Graves, hired 6 months ago, perfect attendance, 0 incidents, no complaints, no commendations, nothing that would make her stand out in any way. Previous employment listed as private contractor, no specifics, no references, no educational background beyond a high school diploma from a school in Kansas that he'd already verified existed. Everything about this file screamed deliberate obscurity. Someone had gone to great lengths to be forgettable. He'd spent the last 2 hours trying to let it go, checking on the patient she'd saved, reviewing imaging, confirming what he already knew. The man would live because a janitor had performed trauma medicine that Morrison still couldn't fully explain. His obsession was growing, not fading. He needed answers. Morrison found her in the basement storage area, tucked in the back corner near the cleaning supply closet. She sat on the concrete floor, back against the wall, knees pulled up. Her hands rested on her knees, still trembling. She didn't look up when he entered, didn't acknowledge his presence at all, just stared at the opposite wall like she was seeing something very far away. You can't just walk away after saving a life like that. Her voice came out flat, distant. I can. I do. Every day I don't do it is a good day. Morrison moved closer, not threatening, just present. What does that mean? The silence stretched. Somewhere above them, monitor alarms beeped faintly through the floors and walls. The constant soundtrack of emergency medicine, lives hanging in balance, decisions being made. She finally spoke. It means I'm done being that person. Morrison crouched down to her level, making himself less imposing. This wasn't an interrogation. It was something else, something more important. What person? A surgeon? A paramedic? Her laugh was bitter, broken, a sound that had nothing to do with humor, a weapon. That single word landed heavy. Morrison felt the weight of it, the self-loathing underneath, the way she said it like a confession. He waited. Experience had taught him that silence was often more effective than questions. She closed her eyes. When she spoke again, her voice had changed, resigned, like she'd been carrying this alone for too long and the burden had finally worn her down. Captain Alexis Graves, Army Medical Corps, Special Operations. Morrison's eyes widened. Special Operations Medical was legendary, the most elite trauma training in the world. Medics embedded with units that operated in the darkest corners of global conflict. I spent 6 years attached to units that don't exist, saving people in places we were never deployed to. The words came faster now, like a dam breaking. 247 combat saves, 89 field surgeries, 34 procedures that aren't in any textbook because I invented them when we had nothing. Morrison tried to process the numbers, 247 saves. That wasn't just experience. That was a career's worth of trauma compressed into 6 years of constant deployment. The technique I used upstairs? Learned it in a cave in Afghanistan. No supplies. Soldier bleeding from shrapnel to the subclavian. Conventional pressure wasn't working. He was dying in front of me and I had nothing. So I figured out how to redirect blood flow using anatomy the insurgents' shrapnel had exposed. She opened her eyes, looked directly at Morrison for the first time. I kept him alive for 40 minutes until extraction arrived, used his own broken ribs as pressure points, turned his injury into the solution. Morrison felt something close to awe. That's incredible. Her face hardened. The vulnerability vanished, replaced by something cold and angry. He lived. 3 others didn't. The weight of that statement filled the small storage room. Morrison understood immediately. Mass casualty, limited resources, the mathematics of triage that every combat medic faced. My last mission. Ambush outside Kandahar. Mass casualty situation. 8 wounded. I was the only medical personnel for 12 minutes until backup arrived. She was back there now. Morrison could see it in her eyes. She wasn't in a hospital basement anymore. She was in the desert, surrounded by the dying. I had to choose. Her voice dropped to almost a whisper. I can still see their faces, the ones screaming for help, the ones going quiet because they knew I wasn't coming. I can still hear the one who kept calling for his mom while I worked on someone else. I can still feel the weight of playing God, deciding who gets a chance and who doesn't. Morrison started to speak, but she cut him off. I chose wrong. You can't possibly know that. In triage situations, you make the best decision you can with the information available. Second-guessing yourself afterward is natural, but it doesn't mean... I do know. The words came out hard. Absolute. Because the kid I saved, 19 years old, abdominal trauma. I spent 8 minutes on him, got him stabilized. He went back out on patrol 2 weeks later and got himself killed by an IED. She paused, breathing hard. The sergeant I left bleeding out while I worked on that kid? He had 3 children at home, 6, 8, and 11 years old. I found out later at the memorial service, saw their faces, saw his wife holding their youngest while the boy cried for his daddy. Morrison had no response. Nothing he could say would change what she'd experienced, the impossible weight of those decisions. I quit 3 weeks after that mission, disappeared, changed my name legally, moved across the country, applied for jobs that required 0 medical knowledge. She looked at her trembling hands. I swore I'd never make that choice again. Never put myself in a position where someone's life depended on my decision. Never play God with other people's children and spouses and parents. So you became a janitor. So I became invisible. Morrison's pager erupted. The shrill tone cut through the quiet of the basement. He glanced at the screen. Mass casualty alert. Level 1 activation. All available personnel report immediately. His phone rang before he could process the page. He answered. Reeves's voice came through frantic, screaming over background chaos. Chief, we're drowning. Bus accident, tour bus versus semi-truck. We've got 8 critical, multiple trauma, 2 ORs available. I don't know who to save first. I need help. I need more surgeons. Morrison looked at Graves. She was shaking her head, standing up, backing away. No, I need you up there. I'm a janitor. You're a surgeon who's forgotten more than my residents know. She continued, backing toward the door, panic rising in her eyes. I can't, I won't, find someone else, call in off-duty staff, page other hospitals for support, do anything else, but don't ask me to go up there and choose who lives and dies because I can't do it again. I won't survive making that choice again. Reeves was still screaming through the phone speaker. Chief, I don't know who to save first. The kid with the head trauma, or the woman with the chest injuries, or the man who's bleeding out from a liver lac. I need you to tell me who to prioritize because I can't. Graves froze. Those words. I don't know who to save first. Her nightmare, playing out in real time. Someone else facing the impossible choice she'd sworn never to make again. Morrison watched her face change. The panic didn't disappear, but something else rose underneath it. Something stronger. I'm not asking you to choose. His voice was calm, certain. I'm asking you to save them all. She stared at him. You can't save them all. Then we save who we can. Together. The silence stretched. Through the phone, monitor alarms screamed. People shouted. The chaos of mass casualty echoed up from the ER above them. Graves closed her eyes. 4 counts in, hold, 4 counts out, combat breathing, controlling the fear response, forcing her nervous system back under control. She opened her eyes. If I do this, I do it my way. No questions. No hesitation. You follow my lead. Morrison nodded without hesitation. Agreed. She walked past him, stripped off her janitor smock. Underneath, she wore a plain black t-shirt. She rolled her shoulders, stretched her neck, physical preparation for what was coming. Let's go to work. The elevator ride up was silent. Graves stood perfectly still, eyes closed, breathing deliberately. 4 counts in, 4 counts out. Morrison recognized the technique, special operations training, controlling heart rate and stress response before engagement. He didn't interrupt. The elevator doors opened on the ER. Chaos, blood on the floors, screaming patients, overwhelmed nurses running between bays, the metallic smell of trauma, every monitor alarming, understaffed personnel trying to manage 8 critical patients simultaneously, a war zone. Graves stepped out. Everything seemed to slow. Her eyes opened, scanned the room, left to right, assessing, categorizing, building a mental triage map in seconds. Morrison watched her transform. This wasn't a janitor anymore. This wasn't even the frightened woman from the basement. This was a commander stepping onto a battlefield. She pointed at Morrison without looking at him. You. Or one. That patient. She indicated a middle-aged man, obvious peritoneal signs, splenic rupture. He needs surgery in the next 10 minutes or he'll bleed out internally. Morrison started to move, but she was already pointing at Reeves. You. Or two. That patient. A young woman, bilateral leg deformities, bilateral femoral fractures, needs stabilization and surgical fixation before compartment syndrome develops. Reeves started to protest. We can't split coverage like that. If we take the only 2 surgeons out of the ER, who's going to manage the rest of these patients? We need oversight. We need... Graves, cut him off. I'll handle the rest here. Go. Morrison found his voice. The rest? There are 6 more critical patients, multiple trauma, head injuries, chest trauma. You can't possibly manage all of them simultaneously without... Her eyes met his. Ice cold. Mission focused. Zero doubt. I said, I'll handle it. Morrison saw it then. The woman who'd performed 247 combat saves, who'd invented procedures in caves with no supplies, who'd kept people alive through pure skill and determination when every conventional method had failed. She wasn't hiding anymore. He nodded, grabbed the first patient's gurney. Reeves did the same with his assigned patient. They moved toward the ORs. Graves turned to face the remaining 6 critical patients, rolled her shoulders once, and went to war. Part 3. Systematic Vindication and Escalating Competence. 2:15. 6 critical patients. Golden hour running out for all of them. Graves stood in the center of the trauma bay. Her eyes moved methodically. Patient 1, patient 2, 3, 4, 5, 6, building the mental map, prioritizing, calculating which ones would die first without intervention. She moved. First patient, young male. Respiratory distress, tracheal deviation, chest tube kit, now. Her hands were already palpating the 5th intercostal space before the nurse arrived with supplies. She prepped the site, made the incision, blunt dissection through muscle, felt the pop as she entered pleural space. Blood and air rushed out. The patient gasped. Chest wall expanded properly. While securing the tube, she called out to the nurse at Bay 2. Start massive transfusion protocol, type O negative, 6 units. That patient has a liver lac and he's in hemorrhagic shock. The nurse moved instantly. Graves finished securing the chest tube, moved to patient 3 without pausing. Compound tib-fib fracture, bone visible through skin. The patient screaming. Reduce that fracture, splint. Morphine 10 mg IV push. She guided the resident's hands, showed him the angle, the traction needed. The rotation to align the fragments. There, hold it. Splint applied. Patient screaming reduced to whimpers as the morphine hit. Patient 4, elderly woman, head trauma, unresponsive, pupils fixed and dilated. The nurse checked with her penlight. Left pupil blown, right is sluggish. Graves processed instantly. Increased intracranial pressure, brain herniating, mannitol, 100 grams of E, elevate head of bed 30 degrees. Page neurosurgery stat. She needs decompression within the hour or she's brain dead. Moving again. Patient 5, middle-aged man, chest trauma. She auscultated quickly. Heart sounds muffled, jugular veins distended. Get me an ultrasound. Fast. The portable machine arrived. She placed the probe. Subcostal view. The image showed exactly what she expected. Pericardial effusion. Significant. The heart struggling to beat against fluid pressure. Start a pericardiocentesis kit. All of this happening simultaneously. Her voice directing traffic, hands moving between patients, eyes tracking 6 different monitors, processing information faster than the staff could follow. Nurse Rodriguez stood near the central desk. 40 years old, 19 years in emergency medicine, she'd seen everything. She's running a mass casualty triage in a level 1 trauma center. Her voice carried awe. Patient 6 crashed, monitor alarm shrieking, V-fib. The young woman from the bus accident, her heart giving out from blood loss. Graves was there in seconds, charged to 200 clear. She delivered the shock herself, started compressions immediately, perfect depth, perfect rate, 100 compressions per minute, textbook CPR. But she didn't stop managing the others. While doing compressions, she called out to the resident at patient 5. Don't wait for me. Subxiphoid approach. Feel for therab margin. Angle toward the left shoulder. Advance until you aspirate blood. You can do this. The resident's hands shook. I've never done this without supervision. You have supervision. I'm right here, and he'll be dead in 3 minutes if you don't move. Kit. Now. The resident grabbed the kit. Graves watched from the corner of her eye while maintaining compressions on patient 6. Good. Prep the site. Anesthetic. Now advance the needle. The resident's face showed pure concentration. Needle advancing. Slow. Careful. Stop. You're in. Aspirate. Blood filled the syringe. Dark. Venous. The pressure around the heart releasing. Patient 5's vitals improved immediately. Heart rate stabilizing. Blood pressure rising. Perfect. Secure that catheter. Graves returned focus to patient 6. Resume compressions. Epi 1 lettering IV push. She worked. Compressions. Another shock. More epi. Pulse returned. Sinus rhythm on the monitor. The patient gasped. Alive. Graves stepped back. Assessed. 6 patients. All stabilizing. 12 minutes had passed since Morrison and Reeves left for the ORs. 12 minutes. In Morrison's OR, he glanced at the monitor feed showing the ER bay. His hands continued the splenectomy, but his mind was elsewhere. Watching Graves orchestrate 6 simultaneous resuscitations. My God, his resident looked up from retraction. Chief? Morrison shook his head, returned focus to his patient. Nothing, just keep that retractor steady. But he couldn't stop watching the monitor, couldn't stop seeing what she was doing down there. The impossible made routine. Back in the ER, the staff had stopped questioning. They watched Graves move between patients, started anticipating her orders. A nurse prepared IV antibiotics before being asked. Another grabbed additional blood products. The respiratory therapist adjusted ventilator settings based on subtle changes in patient presentation that Graves hadn't even verbalized yet. She'd created a unified team in minutes. What had been chaos was now precision, coordinated, efficient, everyone moving with purpose because someone had taken command and given them direction. Young Dr. Kim stood near the trauma bay entrance, first-year resident, fresh from medical school. He watched Graves suture a facial laceration on patient 3 while simultaneously reading CT results on a tablet held by a nurse. Is she even real? Rodriguez smiled. She's real, just operating on a completely different level than the rest of us. The organized calm was almost eerie after the chaos. Monitors beeping steadily, patients stabilized, staff working efficiently. Reeves emerged from OR 2. His patient was stable, femoral fractures fixed. He'd come down to check on the ER status. He stopped dead in the doorway. What happened? The scene before him didn't match what he'd left 20 minutes ago. Then it had been disaster, overwhelming casualties, staff drowning. Now it looked like a well-managed trauma bay with adequate coverage. Rodriguez met his eyes. She happened. Reeves watched Graves finish the sutures. Her hands moved with mechanical precision. Efficient, no wasted motion. She was simultaneously monitoring the patient's vitals, reading lab results, and directing a nurse on medication dosing for patient 4. Who is she? Rodriguez's answer was simple. I don't know, but I'd follow her into any emergency. The doors burst open. Paramedics wheeling in another critical patient, older man, late 60s, clutching his chest, massive MI written across his face in pain and fear. Graves moved to assess, standard approach, airway, breathing, circulation. She placed her stethoscope, listened. Irregular rhythm started running through differential diagnosis, STEMI. Activate the cath lab, get cardiology down here. Start heparin, aspirin, and... The patient's eyes opened, focused on her face. His voice came out weak, strained, but certain. Captain Graves? She froze, actually froze. Every efficient movement stopped, her hands hovering over the patient, her mind suddenly somewhere else entirely. The patient struggled to speak. Kandahar, 2019. You saved. He trailed off, losing consciousness, the pain and stress too much. Graves stared at his face, recognition hitting like physical impact. Sergeant Collins, she knew this face, knew it the way you know nightmares, the way you remember every detail of the worst day of your life. The ambush. 8 wounded. Impossible choices. Collins had been one of the ones she'd saved. Abdominal trauma, arterial bleeding. She'd worked on him for 8 minutes while others died waiting. His friend hadn't made it. Martinez Thompson, 23 years old, massive chest trauma, screaming for help while she'd had her hands inside Collins' abdomen, holding pressure on a severed vessel. The memory crashed over her. "We can't carry them both, Captain. Choose," the voice of her sergeant, forcing her to decide. Collins or Thompson, both dying. Only enough time and resources for one. She'd chosen Collins. Thompson had bled out 30 feet away while she'd saved the man now lying in front of her. Present moment, her hands were shaking. Reeves stepped closer. "Doctor. Ma'am, we need to get him to the cath lab. We need to—" She snapped back, voice harder than necessary. "Right, cath lab, let's move." But her control was cracking. Everyone could see it. She worked on Collins with fierce intensity. Too intense, overcompensating. Her movements sharp, aggressive, the efficiency replaced by something desperate. Reeves noticed her hands trembling as she placed the IV. "Your hands are shaking." "I'm fine." She wasn't fine. Old trauma bleeding through, the past refusing to stay buried. She got Collins stabilized. Blood thinners started. Oxygen flowing. Cardiology called. Transport to the cath lab arranged. The moment they wheeled him away, she walked directly to the supply closet. Morrison found her there 5 minutes later. Back against the wall, breathing hard. The controlled combat breathing from earlier completely gone. Just ragged gasps. "That patient. You knew him," she nodded. "Couldn't speak yet." "One of yours, from deployment?" Another nod. "Did he make it?" "Back then?" Her voice came out broken. "He did. His best friend didn't. Because I chose him instead." Morrison moved closer. Careful. Like approaching someone on a ledge. "You saved him. Tonight and back then. You gave him years he wouldn't have had." She looked up, eyes wet. "I killed Thompson. That was his friend's name. Martinez Thompson, 23 years old. He had a girlfriend. They were planning to get married after the deployment. I found out later. She wrote me a letter asking why I let him die." Morrison started to respond, but she cut him off. "You can't carry that kind of weight. You can't understand what it's like to hear someone screaming your name, begging for help, while you're working on someone else. To know that if you'd just chosen differently, made a different calculation, that person would still be alive." "Yes, I can. I do. Every single day." The alarm from the cath lab cut through the moment. Code blue. Patient in cardiac arrest. Collins. Graves heard it. Froze. Morrison put a hand on her shoulder. "Let cardiology handle it. You've done enough. You can't save everyone, and you can't—" She was already running. Burst through the cath lab doors. Staff scrambling around Collins. V-fib on the monitor. Non-responsive to initial shocks. What's his rhythm? V-fib. Non-responsive to 2 shocks. We've given epi twice, and move. She took over compressions. Perfect depth, perfect rate. Her training overriding everything else. Collins. Sergeant Collins. You don't get to die on me twice. Compressions. Shock delivered. More epi. You have grandkids now. I saw the pictures in your wallet when we were getting you ready for transport. Her voice fierce, demanding, refusing to accept failure. Shock. Continue compressions. Thompson wouldn't want you giving up. He'd want you here for your family, for those grandkids who need their grandfather. Morrison stood in the doorway watching. This wasn't just a doctor saving a patient. This was someone fighting their own past, trying to rewrite history one compression at a time. "Come on, Sergeant, pulse." Faint at first, then stronger. Rhythm returning. Sinus. Regular. Collins gasped, eyes opening, barely conscious but alive. "Still saving my ass, Captain." Graves stepped back, chest heaving, tears streaming down her face. She laughed and cried simultaneously. "That's my job, Sergeant." Collins smiled weakly before losing consciousness again. Stable this time. Sleeping, not dying. The cath lab staff stared. No one spoke. Graves turned, walked past Morrison without looking at him. Out of the cath lab, down the hallway. He didn't follow, just watched her go. She'd proven everything tonight, demonstrated competence beyond anything anyone in this hospital had ever witnessed, saved lives that should have been lost. But the cost was written across her face. She wasn't hiding anymore, and that terrified her more than any emergency ever could. Part 4. Institutional Recognition and Transformation, 48 hours later. Graves sat in the hospital administrator's office wearing her janitor uniform. She'd chosen it deliberately, a reminder to herself and everyone else what she actually was, what she deserved to be. All the patients from the bus accident had been upgraded or moved to regular floors. Collins was in cardiac rehab, stable, alive. The others were healing. 0 preventable deaths from a mass casualty that should have overwhelmed the system. Morrison sat across from her. Hospital Director Chen behind the desk, Chief of Staff standing near the window. This felt like termination. She'd practiced medicine without a license, performed procedures without authorization, overstepped every boundary that existed between sanitation staff and medical personnel. She was ready for it, almost welcomed it. A clean ending, back to invisibility. Director Chen spoke first. Ms. Graves, or should I say Captain Graves, it's just Graves now. Chen nodded slowly, opened a folder on her desk. We've spent 2 days reviewing what happened, the saves, the outcomes, the techniques you used. Graves waited. Here it comes. We also spoke with Sergeant Collins. He was very forthcoming about your service record once he regained consciousness. 6 years Special Operations Medical, attached to units operating in classified theaters, multiple commendations. Graves said nothing. Morrison leaned forward. You saved 11 lives in 12 hours, using techniques I've never seen and frankly don't fully understand. The subclavian compression method, the simultaneous triage management, the field adaptations of standard procedures. The Chief of Staff finally spoke. Your employment file was incomplete. Graves met his eyes. I didn't lie. I just didn't include everything. I listed my high school diploma. That's legitimate. I listed my previous employment as private contractor. That's technically accurate. Military medical personnel are government contractors. I never claimed credentials I don't have, Chen interrupted gently. Your 6 years as a special operations surgeon, your 247 documented combat saves, your 3 commendations for valor under fire, those aren't things most people leave off a resume. The silence stretched. Morrison broke it. I owe you an apology. Graves looked at him, surprised. I dismissed you. Twice? The first time you were in the way, the second time you were interfering. I saw a janitor when I should have seen a colleague, someone with more field experience than most of my staff combined. Graves shook her head. I was a janitor. I chose that. I wanted that. Chen's voice was quiet, curious rather than judgmental. Why? Long pause. Graves looked at her hands, still sometimes trembling when she wasn't paying attention. Because I couldn't be trusted to choose anymore. In combat, you choose. Who lives, who dies, limited resources, overwhelming casualties. You make calculations. This one has better odds. That one has family. This injury is survivable. That one isn't. She looked up. I made those choices until I couldn't anymore, until the weight of playing God broke something inside me. So I ran. Found a job where the only choice I had to make was which hallway to mop first. Chen nodded slowly, understanding rather than pity in her expression. What if you didn't have to choose? What if you had resources, staff, support? What if instead of one medic with limited supplies, you had a full trauma team and a level 1 facility? Graves didn't understand where this was going. I don't follow, Morrison spoke. We want to create a position, mass casualty coordinator, trauma systems director, someone who trains our people to handle the impossible, someone who can teach the techniques you've developed, build protocols for overwhelming situations. Graves started shaking her head immediately. I'm not qualified to teach. I'm not certified. I don't have active credentials. I can't. You are. We saw it. Everyone saw it. Chen's voice was firm. We're not asking you to be a weapon. We're asking you to be a teacher. The words hit differently than expected. Teacher, not soldier, not operator, not someone making life and death choices alone in the dark. Teacher. Graves felt something shift, Small, uncertain, but real. I can't go back to surgery. I can't be responsible for deciding who gets treatment and who doesn't. I can't carry that weight again. Morrison leaned forward. You already are. The nurses follow you. The residents watch you. Even doing nothing, you're influencing care in this hospital. Rodriguez has started using your triage assessment method. Kim is practicing the compression technique you demonstrated. Chen picked up the thread. The question isn't whether you'll impact medicine here. You already do. The question is whether you'll do it from a supply closet or from a position where you can actually help people learn, where you can save lives by teaching others to save lives. Graves looked down at her janitor uniform, the fabric worn from 6 months of scrubbing floors, hiding, running. I haven't operated in 3 years. Morrison's response was immediate. You operated 3 nights ago, on 6 patients, simultaneously, with better outcomes than most trauma teams achieve with full coverage. The chief of staff added his piece. Your credentials can be reactivated, medical license reinstated. We'll support the entire process, provide whatever documentation or testimony is needed. You have 12 witnesses to your competence, 20 if you count the patients who are alive because of you. Graves felt the old fear rising. What if I make the wrong choice again? What if I'm teaching someone and they fail because I didn't prepare them properly? What if my techniques don't work for someone else and a patient dies because I convinced them to try something unproven? Morrison's voice was gentle but certain. Then we make it together. That's how teams work. You're not alone in a cave with no backup. You're not the only medical person for miles. You have support, resources, people who can help carry the weight. She looked at each of them, really looked, saw respect in their faces, not pity, not obligation, not people trying to use her skills. Respect, recognition that she had something valuable, something worth sharing. I need time. Chen smiled. Take it. But know this, Sergeant Collins is alive because you didn't give up, on him or yourself. Think about how many other people could live because you taught someone else what you know. Graves stood, extended her hand. I'll think about it. She left the office, walked down the hallway in her janitor uniform one more time. Behind her, Chen looked at Morrison. Will she accept? He smiled. She'll accept. How do you know? Because she already saved 11 people while trying to hide. Imagine what she'll do when she stops hiding. 6 months later. The new trauma simulation center gleamed with equipment. High-fidelity mannequins, mock trauma bays, every tool needed to train people for the worst moments of their careers. A banner hung over the entrance, Graves Mass Casualty Training Institute. Inside, Graves stood in scrubs, not the janitor uniform, medical scrubs, a white coat over them with medical director embroidered on the chest. She addressed a class of 20 residents and nurses. In mass casualty situations, you don't have time to think. You need to have already trained your response, built the muscle memory, practiced until the movements are automatic. She demonstrated the 4-second bleeding technique, the hand positioning, the pressure points, the anatomical landmarks. This isn't magic, it's anatomy. Understanding how blood flows and how to redirect it when conventional pressure fails, all of you can learn it. The residents practiced on simulators, Graves circulated, correcting angles, adjusting pressure, encouraging attempts. Morrison watched from the observation deck above. Nurse Rodriguez stood beside him. Hard to believe that's the same woman who mopped floors 6 months ago. Morrison smiled. Same woman, different permission to be herself. Rodriguez nodded. We've had 3 mass casualties since she started this program, 0 preventable deaths. The staff response time has improved by 40%, triage accuracy up by 35%. I know, I read the reports. Down in the training center, a young resident failed the procedure for the 3rd time. Her face crumpled, devastation written across her features. Graves crouched to eye level. Again. You'll fail 100 times in here so you succeed once when it matters. That's the point of training. The resident's voice was small. What if I can't? What if I'm not good enough? Graves smiled, genuine warmth. I've been where you are, doubting, scared, convinced I'd make the wrong choice and someone would die because I wasn't good enough. What changed? I learned that the wrong choice is giving up before you try. The only failure is not attempting to save a life when you have the knowledge and ability. The resident nodded. Positioned her hands again. Tried the technique. Success. The mannequin's simulated bleeding stopped. Monitor showed stabilized vitals. Graves smiled. The first real, unguarded smile anyone had seen from her. Pride, not in herself, in her student. Her pager buzzed. Mass casualty alert, real-world activation, level 1. She didn't hesitate, didn't freeze, didn't feel the old panic. Addressed the class. Live exercise, everyone with me. This is what we trained for. They moved as a unit, disciplined, ready, confident. Morrison met her in the hallway. You ready? Graves walked with purpose, shoulders back, head high. I stopped being ready 3 years ago. But, she looked at her team behind her. 20 people she'd trained, who trusted her, who'd learned her techniques and proven they worked. But I'm not alone anymore. None of us are. They entered the ER together. The chaos of fresh trauma, ambulances arriving, multiple critical patients. Graves took command. Her team responded, smooth, professional, every person knowing their role, moving with practiced efficiency. Rodriguez watched from the nurse's station. She's not hiding anymore. Morrison stood beside her. No, she's leading. Graves moved between patients, assessing, directing, teaching even in the middle of crisis. A resident hesitated on a procedure. You've got this. Just like we practiced. I'm right here. The resident succeeded. Another life saved. Another person trained. The cycle continuing. Graves stood in the center of organized chaos, in her element, where she belonged. Okay, people, let's save some lives. The end.